Welcome to the Allura Home Health Vlog. This is a spot where you can get thought leadership, information on topics that matter to your agency today.
Today, we're looking at something many people in healthcare think about. Moving from hands-on patient care into a management role, specifically in a home health agency.
Right. It feels like a natural step for a lot of experienced caregivers, but it's a big change.
It really is. It needs a different set of skills, a whole new perspective, actually. So if you're maybe considering this or you've already made that jump, this is for you.
Mm-hmm.
Our goal today is to figure out how folks with that strong caregiving background can really succeed in these leadership spots.
Because those bedside skills,
Right.
invaluable.
Yeah.
But, running the whole show requires a different lens.
Exactly. So we've looked at a bunch of advice, different insights, all focused on making this specific move in home health.
Yeah, and what really jumps out is that being a great caregiver doesn't automatically make you a great manager. It's foundational, sure. That empathy, that patient focus, essential. But the sources we looked at, they all stress you need to consciously build on those strengths. You need a wider view of how the whole industry works.
Okay, so let's start with those strengths, the skills caregivers already have. We're talking empathy, patience, really listening, communicating well.
All absolutely core to good care. And, our sources definitely highlight how vital these are for leadership, too.
Totally. Like building trust with your staff, handling chaotic schedules, just being dependable. Those are leadership basics.
Absolutely. And think about teamwork, managing stressful situations, advocating for patients. That all maps directly onto managing staff and dealing with the messy parts of running an agency.
Right. Caregivers are often super organized, great multitaskers, and they usually have a strong ethical compass. That's huge for leadership.
It is. But it's also fair to say, and the sources acknowledge this, that these are common strengths. Not every single caregiver has them in spades, and everyone will have things they need to work on for management.
That makes sense because the focus shifts so dramatically, doesn't it?
It really does.
As a caregiver, it's all about that one person in front of you.
Mm-hmm.
But in management, suddenly you're juggling this whole ecosystem.
Exactly. And that's where understanding of the 4 Ps comes in. Yeah. It sounds a bit like jargon, maybe, but it's crucial.
Okay, break it down for us. What are the 4 Ps?
So it's policymakers, payers, providers, and patients. Grasping how these 4 groups interact is, essential if you're going to lead an agency effectively.
Why is that so critical?
Well, think about it. A home health agency doesn't exist in a vacuum, right? Policymakers, government, regulators, they set the rules. They decide what services are covered, how you get paid.
Okay.
Then you have payers, insurance companies, Medicare, Medicaid. They have their own rules, their own focus on cost effectiveness, what they'll actually pay for.
I bet.
Providers, that's the agency itself, the staff. Their focus is delivering good care, getting good patient outcomes.
And finally, patients.
And patients, of course. They need the right care, medically necessary care, hopefully without it breaking the bank for them.
So it's like a constant balancing act. What the policymakers decide affects what the payers cover.
Which affects what services the agency can offer.
And ultimately what the patient receives.
Wow, precisely. And these groups, their needs and goals don't always align. Sometimes they conflict.
Right.
So as a leader, you have to understand these dynamics. Like maybe a new regulation requires you track certain quality metrics.
Yeah.
Well, those same metrics might be what the payers use to decide if you're providing value. And at the same time, your patients are giving feedback through satisfaction surveys.
So you're being pulled in multiple directions.
Yes, you are. And you need to shift from just thinking, what does this patient need, to how does this decision affect compliance, finances, and patient care within this whole system?
That's a big shift.
It is.
Yeah.
One practical tip that came up was actually visualizing it. Maybe make a chart or a board showing each P and what their main goals or pressures are. It helps see the connections.
That's a good idea. Understanding the 4 Ps isn't just knowing the players, it's knowing the game, the push and pull between patient needs, budgets, rules, and what the agency can actually do.
Exactly. Mastering that interplay. That's key to leading sustainably.
Okay, that makes a lot of sense. Now let's shift gears slightly. It sounds like it's not just about changing how you think, but also about filling some potential gaps in education or experience.
Yeah, that's a really important point. Think about the typical training for, say, a CNA or an LPN.
Right. It's focused on clinical skills, getting licensed.
Exactly. Basic patient care. It doesn't usually cover things like running a business, leadership theory, financial management. That's just not the goal of that training.
And even for nurses with bachelor's degrees.
Even with a BSN, leadership might be touched on, but it's often not the main event unless you specifically choose a management track.
Yeah.
So you can't just rely on your clinical background if you want to own or lead an agency.
So what's needed?
You really have to proactively seek out more education or experience. Things like leadership, entrepreneurship basics, and definitely healthcare regulations.
Okay, so where can people find that kind of help? Our sources mentioned a few places.
Yeah, definitely. Small Business Administration, the SBA, that's a great place to start. For general business stuff, they have counseling, webinars, guides, lots of resources.
Okay.
And then specifically for home health, the National Association for Home Care and Hospice, NAHC, is huge. They have resources tailored right for home care providers, both skilled and non-skilled.
You mentioned healthcare regulations again. That sounds like a big one. Our sources really hammered on getting that right. Why is it such a hurdle? I mean, APA alone is complex, right? That impacts records, training.
No, absolutely. And HAPE is just one piece. The thing about home health regulations is not just that they're complicated, but they change all the time. Yeah, these rules cover everything. How you document care, how you deliver it, how you get paid, safety standards, you name it.
So it's not a learn it once kind of thing.
Not at all. It's constant vigilance, constant adaptation. And if you mess up, the penalties can be serious. Fines, losing your license to operate. It's high stakes.
Wow. So you definitely need help staying compliant.
You really do. The sources strongly advise getting expert guidance and ongoing support. Don't try to wing it.
So where do leaders find that support?
Well, like we said, NAHC is great. They even have mentorship programs pairing new leaders with experienced ones, which is fantastic for navigating regulations.
That sounds useful.
Also, the Healthcare Compliance Association, or HCCA, they focus specifically on compliance, webinars, conferences, books, training, all sorts of stuff.
Okay.
And don't forget state-level organizations. State home care associations often have resources tailored to local rules and great networking opportunities.
It sounds like building a good support network is key, not just for regulations, but maybe emotionally too. Our research touched on nurses feeling maybe conflicted or less confident moving away from the bedside.
That's a really insightful point. It touches on professional identity. People often go into nursing because they want that direct patient impact.
Right.
So moving to management can sometimes feel like betraying that, or maybe peers question it like, oh, you're leaving real nursing behind. Yeah. Or maybe you just doubt yourself, am I still making a difference? That's where having a network of other agency leaders is so important.
People who get it.
Exactly. People who understand the unique pressures and rewards. It provides encouragement, shared learning. You don't feel so alone.
And we found some practical advice on building that confidence, right, from James Clear's work.
Yes, his ideas on mental toughness really apply here. He talks about three things. First, clearly define your long-term goals. Know why you're doing this.
Gives you focus.
Right. Second, build small wins. Celebrate the little successes along the way. It builds momentum and belief.
Okay.
And third, be consistent with your habits. Set up routines for key tasks. That provides structure. Helps you keep going when things get tough.
So for an agency leader, that might mean, what, defining the agency's mission clearly?
Yeah, or its specific value to the community.
Celebrating getting a new contract or hiring a great new team member.
Perfect examples of small wins.
And habits could be like daily check-ins with staff or setting aside time each week to read industry updates.
Exactly. It breaks down the huge job of running an agency into manageable steps you take consistently.
That makes sense. Okay, so no deep dive is complete without talking about the big roadblocks. Our sources pointed to a couple of major obstacles for agency execs. Let's start with staffing. Seems like that's always a hot topic.
Oh, it's huge. Universally cited as a top challenge. Finding qualified caregivers and then keeping them.
It's tough. We saw that quote from John Salmons, the agency owner, saying turnover means they're basically interviewing people every single day.
Yeah, that paints a picture, doesn't it? The turnover rates can be really high.
So what are agencies doing about it? It can't just be about recruitment, right? It's about keeping the people you have. It's about caring for the caregivers, too.
Absolutely. Retention is key. And agencies are trying different things, offering ongoing training, chances for skill development.
Like clinical ladders, ways to advance.
Exactly. Clinical ladders, maybe specializing in certain programs to make roles more interesting.
And what about pay and benefits? That has to be part of it.
Definitely. Competitive pay, bonuses, sure. But also good. Flexible benefits packages matter a lot.
And that first impression must count too, right? The onboarding.
Critically important. Pete Morrissey from Right at Home really stressed this. A smooth, positive onboarding and training experience makes a huge difference in whether someone stays. It can't just be paperwork. It has to integrate them into the culture.
Okay, so staffing is obstacle number one. What was the second big one?
Managing the cost of care. Another constant pressure point in healthcare.
Yeah, you hear about rising costs everywhere, inflation, but reimbursement rates from payers aren't always keeping up, are they?
Often they're stagnant or sometimes even decreasing. So you've got costs going up and maybe income going down or staying flat. That puts a real squeeze on agencies.
So what's the temptation? Just cut costs everywhere.
That can be the temptation, yeah. But the sources really caution against that, especially if it harms patient care quality. That's counterproductive.
So what's the alternative?
Looking for smarter ways to operate, finding efficiencies, innovative solutions.
And technology seems to be a big part of that now.
It really is. We saw Stacey Bratcher from Jet Health talking about things like remote patient monitoring, using telehealth for triage.
How does that help with costs?
Well, the idea is it can potentially reduce hospital visits, improve communication, catch problems earlier, which can lead to better outcomes and lower overall costs.
Interesting. So it prompts that question for leaders, doesn't it?
It does. What tech could you use? Upgrading your EMR system?
Yeah.
Better communication tools? What could streamline things and help manage costs better in your agency?
Right. So, okay, lots of challenges, definitely. Staffing, costs, regulations.
It's a demanding job, no question. Being a CEO or leader in home health isn't easy, no matter your background.
But the takeaway seems to be, especially for those coming from caregiving,
Yeah.
that they already have a really valuable foundation.
Exactly. That empathy, the communication skills, that commitment to patient well-being, that's huge.
So the tools and ideas we talked about, understanding the 4Ps, finding resources, building confidence, tackling obstacles, they're about bridging the gaps, right? Building on that foundation.
Precisely. It's about adding the business and systems thinking onto that strong clinical base.
Okay, so let's try and wrap this up. We've journeyed from the bedside to the C-suite, so to speak. We've talked about needing that wider view, the whole healthcare ecosystem, the 4Ps.
Right, moving beyond just the individual patient.
We looked at needing new skills leadership, business basics, navigating those tricky regulations and where to get help, like the SBA or NHC.
And building confidence, finding your network.
And then facing those big challenges head on. Staffing and cost management, looking at strategies like retention programs and technology.
Which brings us to a final thought, maybe a question for you, listening right now. As you think about all this, what's one specific thing we discussed today that really stands out for you? Maybe it's digging deeper into those 4Ps, or checking out the SBA website, or perhaps just starting one small, consistent habit James Clear talked about.
So identifying one area.
Yeah, what's one area that resonates? And thinking about that, what's one small, concrete step you could actually take, maybe this week, to start developing that skill or exploring that area in your own journey, whether you're already leading in home health or just starting to think about it.
That's a really practical way to end it. Food for thought.
Hopefully.
Well, thank you for joining us for this deep dive. We hope these insights are genuinely helpful as you navigate your own path in the really dynamic, really important world of home health.
And, this deep dive is brought to you by Allura Home Health Software.
And they're really all about being that comprehensive solution for agencies,
Yeah, like that one platform that you can manage almost everything from.
Which is interesting because Allura seems to really want to keep the whole industry in the loop.
Not just about their software.
Right, but about all the latest developments and regulations and, even just the news that affects agencies. They really are a top provider of home health software for both skilled and non-skilled agencies.
And when they say complete agency management solution, they mean it.
It really is designed to help everyone from the CEO to the caregivers in the field.
Head over to allurahealth.com or give them a call at 1-800-954-8250 for a free software assessment.
They can help you take your agency to the next level.
And that's a wrap for this deep dive.
Until next time.
We'll be back soon with more insights and advice to help you navigate the ever-changing world of home healthcare.
Stay tuned.